Like with back pain, millions of Americans suffer from neck pain, and for many, the cause remains a mystery. On today's show, we will explore the hidden causes of neck pain and offer you tips on how to best manage and treat those never-ending aches and pains. And as always, we're here to answer your questions. All that and more coming up on this episode of Ask the Doc. No appointments needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, and welcome back to Ask the Doc, No Appointments Needed, the show where the health questions you send in are answered by our doctors and medical experts. I'm Dr. Georgiy Brusovanik, a board-certified minimally invasive spine surgeon, and thank you for joining us today. Okay, let's get right to our questions. Our first is from Dana, who emailed us asking about shoulder blade pain. Perfect. And she writes, "Hi, Dr. B. I am a 45-year-old woman who has suffered from my arm tingling and pain in my shoulder blade for some time now. Doctors so far have not figured out what it's from. I know you haven't seen me, but any ideas of what's going on?" Dana, thank you for writing in. In my practice, I see patients like you probably 30-40% of the time. The problem is most likely coming from your neck. And I can only tell you in terms of likelihood, because obviously I haven't examined you and I haven't seen your neck MRI. But that's where it starts. Shoulder blade pain, 9 out of 10 times, even 95 out of 100, comes from the lower discs in your neck. If you add to that description, shoulder blade pain, and if you add to that tingling in your arm, it raises the probability that the problem is actually coming from your neck probably to like 99%. If you tell me headaches, if you tell me stiff neck in addition, then it's as close to a cervical disc problem as you can get without confirming it with an MRI. So my advice to you and to anyone else out there who has shoulder blade pain with tingling going down the arm, you need a neck MRI. Ask your doctor. You don't need contrast. It's just a simple prescription. And if your doc is not going to write you one because you haven't tried therapy, which is not really applicable until you have a diagnosis, until you know exactly where the pain is coming from. So message us and we'll send you a prescription. Thank you for this question, Dana. Every case is different, but your case reminds me of so many others. And most people like you, Dana, come misdiagnosed. Most patients who have isolated shoulder blade pain, even with arm tingling, will have tried some crazy massage with a lot of force, some injections around the shoulder blade. Chances are it's just coming from the neck and it's referred pain, or pain that we feel in a location different from where it's actually generated. All right. Next question comes to us from Bill, who emailed us and asks, I apologize. I'm 35 years old and I've been treated for chronic headaches that doctors said are migraines for years. However, nothing has changed and I'm miserable. Could it be something else? Great question, Bill. So again, that's probably the second most common thing I see related to disc herniations or degenerative discs in one's neck. As soon as your neck gets stiff, you irritate this little wispy sensory nerve called the occipital nerve, which goes through the neck muscles up to the top of the head. So reliably, when patients have a problem with their neck muscles, usually due to a disc problem, but whatever, neck stiffness, it will cause this headache sort of in the back of the head. You can even go to the front of the temples, and if you find the culprit, if you get a diagnosis, meaning if you find out that it's coming from a disc in the neck and you get a proper injection, you may see the headache just evaporate. So a long period of time of taking migraine medicine with no relief, to me, is an indication to keep on looking, meaning a neck MRI. Great question, Bill. All right, our next question comes from Chelsea, who emailed in and asks, I'm 40 years old and I've had jaw pain for years. Orthodontists and even TMJ specialists have not figured out what the pain is coming from. Have you had any similar cases, and how have you treated them? Chelsea, I've definitely seen jaw pain related to neck pain, and it's almost always from C5-6. So if you get a neck MRI and you read that you have a C5-6 degenerative disc, then it's very possible that that disc is causing pain behind the jaw. I'll tell you from my personal experience, I remember this lovely physician who flew in from the Bahamas who had her teeth pulled because of a suspicion that it was a dental issue, when in reality, it was all related to a cervical disc. We did an MRI, we confirmed the disc, we injected it, her pain went away. This poor woman underwent unnecessary dental work. So that's a really great question, another common problem. So jaw pain, headaches, shoulder blade pain, all of that can come from a problem in your neck. All right, some great questions so far, but we still have time to answer your questions. And so easy to send them in. Here's how.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Let's keep it going. Our next question comes from Eric. And Eric writes, my mother's neighbor had sudden severe pain on the left side of her neck. She thought she pulled a muscle, but in reality, when the paramedics arrived, they realized she was having a heart attack. Thankful, she's okay. But my question is, how should we know the difference between neck pain and something more severe? Well, Eric, that's a really, really tough question and a super important question to ask. So essentially, well, first of all, to address the story where a patient was complaining of neck pain, your neighbor's mom, and then it was actually a heart attack. I'm so glad that you brought that to our attention. And by the way, there are other ominous processes like a pulmonary embolism, where blood clot goes to your lungs, that can also present with neck pain. Look, if there's any association of neck pain, then it's important to mention to your doc. So in other words, neck pain and shortness of breath, neck pain and chest pressure, then it would be important to be worked up. Now, if there is a history of cardiac issues, then you got to have a higher level of suspicion. But on top of that severity, neck pain that you can sort of deal with is likely not going to be a heart attack. A neck pain that's the worst neck pain ever, pain that's atypical, and again, pain that's associated with these ominous signs like shortness of breath or feeling like you're about to pass out, definitely deserves a 911 call. And don't drag yourself to the hospital. Definitely call 911. Give the paramedics the best chance. Give yourself the best chance through the hands of the paramedics. So how do you know if it's something more severe, Eric? Basically, severity, if it becomes intolerable, if it's associated with upper extremity numbness or weakness, if it's associated with low extremity weakness or numbness, because then we have to consider a stroke. With all the resources available these days, don't just sit on it. If it's bad enough, definitely ask for advice. Ask a specialist. Thank you for asking this, Eric. We're glad to hear that she's okay, though. All right. Philip followed us on Instagram, and he writes, my friend is 55 years old and has been a smoker for years. He has had to deal with pain in his neck and trapezius. He has been going to physical therapy, but it hasn't helped. I don't want to worry him, but could there be some other underlying cause related to smoking? Philip, I'll tell you a story, and it's a very difficult, very personal story. A patient was sent to me by somebody I work with in the hospital. It was her mom, and she had something similar. Long story of smoking and then neck pain and trapezial pain. Because she's older, it comes to no surprise that when we obtained an MRI of her neck, she had some degenerative changes. Now, non-specific neck pain or pain that's described as kind of vague can still be caused by a degenerative disc. So I sent this patient for some injections to confirm the diagnosis, as I do with most of my patients. And nothing worked. This poor lady was screaming in pain, and the injections weren't even touching her. I believe within 2 to 3 months, we obtained a CT scan of her chest, and it showed what's called a Pancoast tumor, a cancer at the top of the lungs. It was heartbreaking, and I caused a delay in her treatment by about 3 months by trying all these neck injections. I carry that case on my shoulders. I feel very bad about this situation, but it just highlights the fact that, and now because of that, I've learned that when patients have severe pain that's out of range with what I expect, combined with possible weight loss or nighttime symptoms, which although are less relevant, are still important to tell your doc. It would be a really good idea if the patient is not responding to conservative care, especially to get further imaging and look for other causes. They may be zebras. They may be quote unquote zebras as in they're unusual. If you hear hoofbeats, it's likely horses, not zebras, right? But if your doc is not sharing your concern, get a second opinion. Thank you for this question, Philip. Let's continue on with a question from Gwen, and she writes, my husband has had chronic neck pain and has undergone multiple facet joint injections and nerve burns with no relief. Any suggestions of what else he could be doing? Gwen, so the fact that your docs have injected the joints in the back of the spine and then desensitized them via these procedures that you mentioned, burning of the nerve, tells you that that's not the cause of his pain. Now, in my book, that's a lesser common cause of neck pain following discs and disc-related pain. So I would bet your husband could benefit from injections related to the disc, as in transforaminal epidural injections. So don't be disheartened by the failure of these injections. Take this data as just that, as information that tells you that that's not the cause of his pain. Look, with spine, it's very important to really isolate the source. And sometimes it's a bit nebulous. It's not always obvious, especially when we don't have nerve pain or that real annoying element of pain where you feel pain in your central skeleton, but then it shoots to the arms or to the legs. All right, great question. Thank you. We just got a question from Jen, this time on our Facebook page. And she writes, I need your help, Dr. B. I'm 45 years old and I have this persistent neck pain on the right side that really gets painful when I turn my head. Treatments haven't done anything. When you talked earlier about the woman's neck pain, that was actually a heart attack. I got very nervous. Any idea of what my pain could be from? All right, very important, Jen. And I don't mean to freak out the listeners, even though, yes, chest pain or neck pain can be a sign of a cardiac process. That's far, far from the most common cause. So you mentioned something very specific. Jen, your pain gets worse when you turn your head. Now, that's a feature that we describe as mechanical pain, meaning it's related to some mechanical motions or positions of your head. Now, believe it or not, that's very encouraging. That tells you that there's going to be a musculoskeletal underlying cause, much more likely than something visceral or an organ problem. Organ problems shouldn't really be impacted by the position of your neck. But if you have pain coming from the joints in the back of the neck or emanating from the discs, then neck position will make a difference. You deserve a neck MRI. I appreciate this question, Jen, and I hope this helps. Make sure you talk to your docs about getting a simple neck MRI, and specifically make sure no contrast. Nowadays, with good quality machines, you don't need to have that IV contrast. It just potentially hurts your kidneys. All right, we still have time to answer your questions, and it's so easy to send them in. Here's what you need to do so.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Next question is from Maria. She checks in on Instagram and she asks, Dr. B, my problem is my throat and more specifically pain when I swallow. I've gone through test after test after test, but no results. Any suggestions of what it could be? Like so many of the other people today, I wonder if it could be something with my neck. It's like, Maria, today the theme is I have something, but it could be something else. And, that's a sort of a very wide topic because neck pain specifically can be a few other things. Now, look, In med school, we're taught to break things down into simple parts. So infection, neoplasm or tumor, trauma, degenerative conditions, and congenital conditions. These five categories essentially sum up most of the problems. Now, being that you're an adult, chances are it's not congenital. If there's been no trauma, you can rule that out. Infection, you'd have other things, you'd feel sick, but it's possible. Now, neoplastic processes are always a concern, right? We always get some weird pain and we say, oh my God, is it cancer? It's very unlikely to be cancer. And swallowing pain, specifically after test and test and test, chances are involved some upper GI studies, endoscopy. So, God willing, you don't have a pathological process. But there is a weird neck thing that can cause swallowing issues and pain. And that's when we have wildly overgrown bony osteophytes. Now, look, when you get your MRI result or a CAT scan result, you may find I have osteophytes. Don't let that freak you out. But in an unusual scenario, I've had maybe 5 patients over the past 2 decades where these patients had swallowing issues because of overgrowth of bone. In fact, on a couple of patients, I went in, shaved the bone, and they were able to go back to eating. In fact, this one man was very close to dying. All he wanted to do was make dinner for his family. I'll never forget this guy. And I told him that, look, you may die through this operation. And he said he didn't care. He was very old. He said, I just want to cook for my family. I was afraid to operate on him. We agreed that in his life, his benefits will outweigh, his benefits outweigh the risks. We did it and he survived. He actually cooked for his family. It was very rewarding. So, Maria, get an MRI of your neck and it will readily show if there's some process behind your esophagus that's making it hard to swallow. Thank you for this question. Our next question comes to us from Francis, who reached out to us on Instagram. I'm a 70-year-old man who has neck pain and also progressive difficulty swallowing. Could my issue be similar to what happened to the previous person? Have you dealt with other similar cases? And does it ever require surgery? Francis, it's a rare cause. In a young person, I would say it's almost never. But at 70, it's possible to have sufficient osteophytes or bony overgrowth that would produce issues swallowing. Get an x-ray really of your neck. And I think it would be a good idea to get what's called a swallow study as well, where x-rays are taken of your neck while you swallow some material. So it would be a good idea to really get some musculoskeletal studies. And thank you for this question, Francis. All right, so we have a question from Vada, and this is coming to us through Instagram. I've been diagnosed with spinal stenosis and I have a lot of butt pain. The MRI shows narrowing in the butt area. Also, the medication is not helping with the pain and the agony. Please help. Vara, if your pain is mostly with walking or standing, but sitting is not causing your pain, then stenosis in your case is relevant. And it's kind of a good problem to have because it's totally fixable. So narrowing in the canal or stenosis will produce issues with severe pain over your buttocks, especially when you walk. Patients will say, I feel cramping, I feel numbing sensation. It's super common. The good news is that it takes about an hour procedure, minimally invasive, to open the area, and then you can go back to walking same day. Thank you for this great question, Vara. All right. So let's get back to next question. And this one is from Nick, who reached out via YouTube. Nick asks, I am 52 years old. I'm a man who's been dealing with both neck and shoulder blade pain. A doctor gave me a targeted injection. The pain vanished completely, but only for a short while. And now the pain has returned. What can I do now? Nick, your injection was not in vain. I'm sorry that it didn't last, but you confirmed the source of your pain. Think about it, a targeted injection behind C5, C6. If you know for sure that that took away all your pain, then if you have a disc replacement, if you have a procedure to address that disc, your pain will similarly be gone. So I would take that as nothing but good news. Now, just make sure that your injection wasn't just diagnostic, in which case lidocaine is used, a local anesthetic, but steroids are not. So it would be important to add that second ingredient, the steroid, true world's greatest anti-inflammatory, and that may actually provide you lasting relief. So that would be a good thing to ask your doc. All right, let's jump to the next question, and this one is from Lawrence. What is the difference between a strained neck and a sprained neck? Are they treated differently? How do I know which one applies to me and how to handle it? Lawrence, this is a common question, but don't get bogged down by nomenclature. You can't really strain or sprain your neck in medicalese. So you can have a muscle strain where muscle, in an attempt to do something, gets overextended, and that may hurt. And then you can have a sprain of a ligament, where, for example, as you turn your ankle, the ligaments will get pulled, and then you can call that an ankle sprain. The reality is that if you overdo it, your back will hurt. It will reliably get better quickly. Call that a sprain, a strain, or just an achy back. If the pain continues, or if the pain is associated with other sensations, like pain going down the leg, then you need a diagnosis. And again, you can call it a disc herniation, a degenerative disc, a lumbago, but you got to know exactly where the pain is coming from. Your docs need to know exactly where the pain is coming from. You need a diagnosis. I stand by that as the most important thing that patients need on their way to recovery. Thank you for this question. All right. Sherry emailed in, and she has concerns surrounding her pillow. And she writes, can you explain the process of choosing the right pillow? Some days I wake up and am in serious discomfort and a sore neck. Sherry, there is some limited science when it comes to choosing your mattress and your pillow. There are some innovations that are coming out soon, and today you are limited to really addressing your neck pain as opposed to just trying different expensive pillows. So if you're waking up with pain, there is some good news. Morning pain is often inflammatory pain, meaning that if you get an MRI and your MRI shows that there's a pathological disc, and you get that disc injected with a mix of lidocaine and a steroid, the steroid may really do the trick for you. When patients complain about neck pain and when they come to see me, and they tell me that their pain is most significant in the morning, it's actually a very encouraging sign that the steroid will knock it out of the park and you'll regain your normal life. I know that there's a lot of arguments online about steroid injections not being FDA approved. There are a lot of things that we do in medicine that aren't FDA approved. Steroid injections are a mainstay of treatment to avoid patients from having surgery, to help them avoid surgery. And the best way to really solidify the diagnosis. So if you were to come to me with a problem related to your neck or neck pain, chances are I won't be rushing you into surgery. I'll be telling you, let's confirm that you have the right diagnosis. In that process, in the delivery of steroid behind the supposed culprit, we also attempt to get you to avoid surgery. And if it's mostly morning pain, which is a sign of inflammatory pain, that injection may really knock it out of the park. I hope you give this a thought. Thank you for this question, Sherry. We have another question that came in, and this one is from Randall. And he writes, is there a relationship between stress and neck pain? I noticed that when I get stressed, my neck pain gets worse. Is that a myth, or could it be from something else? Randall, that's a great question. There's been a lot written about stress and back pain and neck pain as well. And there's been a lot written about catastrophizing, as in thinking that your neck pain is a sign that you're doomed. Those patients who catastrophize don't do as well long term. And there is definitely some psychological relevance to our neck pain. There are definitely examples of neck pain being exhibited by stress. But as an objective orthopedic spine surgeon, my job is to find a cause that I can correct. Stress is going to come and go, and the way you react to stress is going to be your own ability to sort of deal with daily perturbations. So stress isn't going to go away, but I look for objective causes, as in, like, I'm looking for a candle that's making a light in a dark room. So if a problem resembles those specific findings that I see associated with it, for example, shoulder blade pain, neck pain, headache, jaw pain, and pain going down the arm towards the thumb and the index finger. If that is what you present with and an MRI confirms you have a C5-6 degenerative disc, chances are stress may be contributing, but the pain is coming from C5-6. Don't let your docs write off your symptoms as just something psychological. You deserve a diagnosis, meaning you deserve to find out exactly where the pain is coming from via proper consultation, an MRI, and then you deserve a chance to try to avoid surgery. That means a properly targeted injection, which will hopefully get you better, get you to avoid surgery, but to the doc, it will also confirm exactly where the pain is coming from. I appreciate all these wonderful questions today. Neck pain isn't always what it seems, and as you've heard, if you're continuing to suffer from related symptoms and your needs aren't being addressed, get a second opinion. Thank you for visiting. Ask the doc. No appointments needed. See you next time.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.